This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Supposed to
help us.
Medical Dilemma.
Hi, I'm Sonny Del Rosario, and thank you for tuning in to Medical Dilemma. While we take pride in our practice of taking care of our elderly, we probably are not aware that ethical issues have greater significance in their case. The elderly are more likely to be taken advantage of than the average adult because their interests could be easily sacrificed in favor of the interests of those that supposedly look after their welfare. In this episode, we review the rights of senior citizens and the ethical issues that highlight their golden years. Now, with me for the first segment of the show is Dr. Jacqueline Hernandez King, an ophthalmologist, board examiner, and training officer of the Department of Ophthalmology at the Makati Medical Center. A pleasure having you in the show, Dr. Hernandez King.
My pleasure too. Thank you for having me here.
You're welcome, po. Now, in the second segment, we will have Attorney Lourdes Pagayatan, Vice President of the Women Lawyers Association of the Philippines. So we will have her after the commercial break. Now, Doctora, let's first discuss certain conditions that elderlies usually are prone to. And I suppose one of this is the development of cataracts.
Yes.
Okay. Now, for the benefit of our viewers, could you define what is a cataract or describe what a cataract is?
By definition, cataract is the opacification of the lens. So patients would normally notice that their vision has become blurred despite wearing their glasses. Some would complain of glare and loss of contrast sensitivity.
So if I were to describe it in like layman's terms, is it something like the lens is clouding up or becoming more opaque such that light does not pass through?
That's more than a layman's term.
Okay.
But they would say, yes, their vision has become cloudy. But you don't normally see the lens opacifying unless you, especially in the beginning stages, unless you use special equipments or magnifiers.
Are there different kinds of or classes of cataracts?
There are. First, you have your congenital cataracts. You have diabetic cataracts, or drug-induced cataracts. But the most common would be your age-related cataract.
Age-related cataracts. Okay. And normally, how does age-related cataract develop over time?
Well, it usually commences at around age 60.
Okay, age 60.
Sometimes you can have it earlier, especially for those who are always exposed to a huge amount of ultraviolet light. So, or those who are diabetic could have earlier cataracts.
Now, what are the signs that a person could watch out for to determine if he or she has started to develop cataracts?
Sometimes they would notice that their vision is not as clear as before. Or when they drive, they would easily complain of glare. And most of them would have gone to an optometrist to have their glasses checked. And in some instances, no amount of glass or refraction could improve the vision. And probably this would alert you to see your eye doctor.
I see. So it's only the eye doctor that can tell you that you are starting to develop cataracts, not the usual optical shop at the mall.
They could detect cataract, but then the ophthalmologist is trained to confirm the diagnosis.
And how does an ophthalmologist confirm the presence or the start of cataract development?
Well, we make use of, pardon me, you're asking if the vision, how
would you detect, or what method or practice do you detect?
We use the biomicroscope or the slit lamp, it's a magnifier. It's a magnifying lens so that we could see the anterior segment and the lens in the eye. If there's any opacification, then we could say that there's a cataract. We can also use our ophthalmoscope to see if there's any block in the fundus light reflex of the eye.
Okay, let me just confirm. You mentioned that age-related cataracts are caused mainly by ultraviolet rays. Am I right?
Not mainly.
Not mainly.
One of the factors that may accelerate the development of cataracts.
I see.
Some have even mentioned, there's some studies that have related it to nutrition and even the social status of the patient.
Even the social status
Yes,
of the patient.
there are studies like that.
All right. And once a person has developed cataracts, is the only option surgery?
For treatment, for complete cure, yes.
For complete cure, it's only surgery.
Yes.
Okay. And how would you advise a patient if supposing that's the only option left for the patient?
Normally, we give them the option because cataract surgery is always elective. It's not urgent in most cases. So that we first try correcting their vision using glasses or spectacle correction. If we are able to correct the vision to a level where they are rendered functional, then cataract surgery may be delayed or not. Whereas sometimes when the vision is not correctable anymore, then we can offer cataract surgery.
Cataract surgery. What are the risks that come with having cataract surgery? Are they considerable?
The most dreaded nightmare of any ophthalmologist would be an eye infection.
Okay.
Although this is very rare, but then once a patient is affected by it, then you can actually lose the vision.
I see.
There are other complications or risks that may happen, but most of them are manageable.
So how do you lower the risk of eye infection?
We follow strict protocol of infection control. Some surgeons have started using antibiotic drops before surgery. We make sure that the environment, the operating room, is very clean. We make sure also that the patient has no concomitant infection around the eye, as most of them would have some blockages in their tear ducts that may predispose one to infection. One may have chronic blepharitis or infection around their lids. So these are checked meticulously before surgery. During surgery, the staff, the ophthalmologist, is responsible for making sure that everything is followed to the T. And after surgery, we ask the patients to continue applying the antibiotic drops to make sure that they get well smoothly.
Okay. And these days when you have cataract surgery, do you have to be hospitalized after?
Most often we do it as an outpatient procedure. So seldom do we. There are some doctors where they offer patients to be confined if they have other problems needing medical attention, but most are outpatient, done as an outpatient procedure.
I see. Now, what is the probability of success for a typical cataract surgery?
I don't have the exact percentage, but I would say around 99%.
98 to 99%.
Yes.
And what could cause the other 1%?
Well, if you are
failure?
unfortunate to have some infection or some inflammatory conditions
Prior to the operation?
after surgery.
Or after
Yes,
surgery?
yes.
I see. Okay, thank you so much, Dr. Hernandez-King. We will take a short break this time, and we'll be right back with Attorney Pagayatan and Attorney Teresita Sanchez. Just a few words from our sponsors.
products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other types of it. So you hear it, you see it, and then you can smell the fireworks. Now put it to the game by asking you're already practicing.
You need a word here against you. Words can inspire and words can destroy. Choose yours. Okay?